You'll often hear people talk about where cartilage is going to come from in a revision rhinoplasty, and probably you'll hear rib the most and then ear. And why is that? So you should know that septum is the best cartilage to use for rhinoplasty, and that's our preferred source as a surgeon, first and foremost. But you only have so much of it to give. And once you run out because of your prior rhinoplasties, then we have to resort to these other sources of cartilage. And why do we pick what we do? Okay, so rib adds more structure. It's closer to septum in terms of strength, but it has some downsides. It can be a little bit too firm. It could be calcified at times. And then if we need a soft source of cartilage, then sometimes we'll go to ear, but that's pretty rare. And then the last piece of tissue you'll hear a lot about is fascia. So we can get fascia from your scalp. We could get it from behind your ear where it's thicker, called the mastoid fascia. And this is a layer of covering because sometimes people have areas of thin skin from the prior surgery, and we may need a blanket to put over the cartilage to soften it and have it look back to normal. And this is what makes revision rhinoplasty so difficult is we don't know exactly what we need to do until we get in there. And so you need to think on your feet a bit, and you have to be prepared for all different options. So you before getting your revision rhinoplasty should know that rib versus ear versus fascia should all be on your consent that we may need to use this material, because when we're in there, we're gonna figure out the best way to get to that outcome you're searching for. And that's really what we need to know from our patients is what are your goals, what are we trying to accomplish, and we should figure out as a surgeon the best way to get there.